So I've just entered my patient's room and I'm going to wash my hands. The first thing that I like to do is to check my patient identifiers and at the same time do my IV assessment. So here I have Reese Elliott and I'm checking against my MAR. J number is 1, 2, 3, 4, 5, 6, 7. I'm also going to check my IV site. So I want to see that it is actually patent and infusing. So the way that I double check that is I look to see that the green indicator light for the primary is blinking, and then I go from the bag. Okay, I can see that it's dripping in the drip chamber, and then I can follow all the way down to my actual IV site. If it's not leaking and there's no signs of infiltration or that it's gone interstitial, I can assume that it's actually going into the vein and that it's patent. So this is running at 50 mils an hour. Okay, I can see in the bag there's a little less than 800 mils. There's quite a bit still left in this bag to still run in. And my patient isn't complaining of any pain or tenderness at the site. So this IV site looks good, which makes me very happy. I also assessed this ahead of time. You guys heard me say that in the previous video. Assess it again. Something can happen in between your first assessment and now. So you just want to make sure that you're always eyeballing it before you actually start your medication admin. So for this medication, for Ancef, I would do education for my patient. I would let them know that this is an antibiotic that was ordered by their physician and that it's for their lung infection. Remember, your patient does have the right to refuse here, okay, even though it's going into the IV. So I'm going to hang up my secondary med and I'm going to open up the actual tubing. It does come with a hook, but for plum, we can just keep them at the same level, so we don't usually use those. Okay, and then I'm going to make sure that I put my clamp on, my roller clamp on right away, and that I maintain the sterility of these two parts here. So I'm going to pull off the blue cap, and I'm going to maintain sterility by spiking the bag. I lost my alcohol swab. So I would take my alcohol swab and I'm going to swab the clave that I'm going to connect the IV to. So it has been swabbed. I'm going to lure lock this on. Okay, and then I need to back prime. I attached my bag. You guys don't have to. You can back prime before spiking. If you spike and then back prime, make sure you're holding it upright so that you see the drip chamber filling. If you can't and you're holding your bag sideways, you're just going to keep filling this little bag and all of a sudden you're going to be left with like this big balloon. So just make sure that you guys are holding it upright. So right now my primary is running. Okay, so I do have to hit stop. I can't see the back prime button until I actually stop the primary. Now back prime pops up. Okay, so with the actual clamp open, I'm going to press and hold back prime, and it's actually going to take fluid from your primary bag and it's going to backfill your line and your drip chamber. Just a reminder that if you're back priming with the cap on, if you haven't spiked it yet, you might get a distal occlusion screen. It's because you still have the cap on your spike and some pressure builds up. So that's the only part I don't like. That's why I like to spike the mini bag and then back prime, because all your air will just get filtered into this bag and it'll work itself out. If you don't do that and you have the cap, you're just gonna have to remove the cap as you're back priming. So you can see my drip chamber is filled to the line. Now I can hang it. I do want my primary to kick back in once my secondary is done. So I'm gonna set my primary screen. So I'm not gonna clear it, no. I'm actually gonna hit start. Yes. So I know right now that A is running. That's my primary maintenance line of 0.9% sodium chloride. Now I'm gonna hit B. Okay, and I have to do my math here. So again, natural stopping point. I didn't do it ahead of time, and that's okay. We can do it now. I'm running a 50 ml bag in 30 minutes, so I know off the top of my head I can run that at 100 mils per hour. If you need to do the calculation for that, you're gonna do volume over time. So I would do 50 mils over 30 minutes, and I would times it by 60 to get it into hours, and it would give me that 100 mils per hour. So my rate will be 100. VTBI is volume to be infused. It means the mini bag. So let's put 50. Remember, we don't do less for a piggyback. We only put less for a primary so that the bag never runs dry. But with secondaries, we don't do that. So we put the full 50. So it's going to take 30 minutes. So it's nice because the pump actually does like a second check of your calculations. And then you can just hit start. And then yes. And then here it's going to say your primary is pending and your secondary is pumping, and that green indicator light is now going to be flashing. Before you leave the room, guys, make sure that it's actually dripping and that there's no clamps on. Okay, so this one is off. I'm going to make sure to see that it's infusing. Okay, so we're good to go. So I would make sure that my patient is safe and comfortable, and I would leave the room. I know that in 30 minutes I'd probably come back and eyeball just to make sure that my primary did kick back in and that there's no complications with the IV still, as that medication was introduced to the vein or the vessel. I would also come back, so I would leave and document on my MAR that the antibiotic was given, and I could also add the time to my secondary on the actual label as well, so I could put 6:30 or whatever time I initiated it. And then when I need to come back and evaluate, I'm not necessarily evaluating the effectiveness of the drug because it's an antibiotic, but I am evaluating any adverse reactions or side effects that the patients might begin to experience if they do have any. So once that's all done, I would just make sure that I document any significant findings. And then that's it for the skill. If you guys have any other questions, please feel free to email us and clarify. Otherwise, good luck and happy studying.